a recording on this computer. You're ready.
Okay. Good evening, everyone, and welcome to Portsmouth Coffee Talks Evening Edition show. We welcome all you and all the people that are watching on Leah Stitt's Facebook page. And my name is James Slim Overton. I'm here with co-host Leah Drake Stitt. And if you don't see the Colonel, because he had another meeting tonight and he won't be with us, well, he might tune in. We don't know. But anyway, in his absence, we will represent him. But anyway, we have a special guest this evening, and Leah, well, let me do what the Colonel says,
The disclaimer.
The disclaimer, and I don't know if I can do it as well as he does. The comments and words expressed here on this show are of the host and the guests and no one else. And just wanted to make sure you know that. So when you get upset with something that's said, which I don't think happened tonight, but just remember I made that disclaimer. And Colonel does it much better than I do. But anyway, Leah, if you'd like to introduce our
I'll
guest.
tell you, it is my pleasure, my extreme pleasure to introduce to those of you out there who may not know him, Mr. Nathan Woodard. Nathan is the Director of Behavioral Healthcare Services here in the city of Portsmouth. Nathan previously was a licensing specialist, a regional manager at the Department of Behavioral Health and Development. He has also served as a clinical services coordinator, senior licensing specialist for the Commonwealth of Virginia. He has also served as a mental health caseworker and an emergency services clinician. And most of all, that I found most amazing is that Nathan was a residential counselor at the Pines Residential Treatment Center. And Nathan, I find that so special because I worked at the Pines for many years. And I think that you came after I left to go and work in state government. So we have a lot in common here, Nathan. And I'm also happy to tell you all that Nathan, as well as 12 others from the city of Portsmouth, served on the mayor's Bloomberg Harvard study. And I'm sure that he would share a little bit of that information because he was one of the leads on the Bloomberg Harvard study. So Nathan, we are so happy to have you here today, primarily because a lot of people really don't know what takes place at behavioral health care. Many people just think that you're there for drug services, and James will talk more about that as well. But we thought it was time that we brought you on so that you can share with the citizens of Portsmouth all the great things that are taking place at the behavioral health care.
Well, good evening to both of you guys, and thank you again for having me this afternoon. Thank you for the introduction, Ms. Leah. Yeah, I worked at the Pines Residential Treatment Center way back in the 1990s.
Yes.
So that was certainly a flashback. So I've had the opportunity to not only work with kids, but to work with adults as well.
Exactly.
But in my current position here at Portsmouth Behavioral Healthcare Services, I serve as the Executive Director of Behavioral Healthcare Services. Almost 2 years now. April will make 2 years, and I have really enjoyed it.
Mm-hmm. And the amazing thing, and the good thing, not the amazing thing, but the good thing is that you have served in those positions that some of those individuals who work under you, so you understand what they're going through and what services they need to provide. And that's a good thing.
Exactly. I think it's very important that I can connect with my staff on that level when talking about the services that we are providing to the citizens here in Portsmouth. I've had the opportunity to do those services, as you mentioned, to be a residential counselor, a case manager, an emergency services clinician, just to name a few. Mm-hmm. So whenever there are questions or things that we need to kind of mule over to see how we can do them better, I can talk from that practical experience from having done it in the past, which I think makes a difference.
It does make a difference. It does. And share with the public, what services do you provide at Behavioral Healthcare Services?
Well, here at Portsmouth Behavioral Healthcare Services, we provide a plethora of services. First of all, we service individuals that are recovering from a mental health, a substance use, or diagnosed with a developmental disability. We serve adults as well as youth. The Community Services Board, which what it was years ago, started approximately in 1965. Portsmouth CSB was one of the first 5 CSBs here in the Commonwealth of Virginia, of course, known as now Portsmouth Behavioral Health Care Services. During that time, we provide a lot of services. First, we provide case management services to adults and kids. Within our case management services unit, we assist, link, and train individuals on different resources that may be in the community. We help them to get benefits. We try to find them housing, stable housing, more namely affordable housing. And we also try to just do some supportive counseling with them so that they can maintain in the community. We also provide medication management. We have 3 board certified psychiatrists here that provide medication management for an array of disorders. Those disorders may include depressive disorder, schizophrenia, or bipolar, just to name a few. We also have what most people know us from is our methadone clinic.
Yes.
We not only provide methadone at our clinic, we also provide what's called Suboxone. These are medicines that help persons that have had an opiate addiction in the past to try to mitigate that addiction. It helps them to taper off of that opiate that they once was on. We all coupled with that, we also do counseling and therapy for them. Again, the hope with this service is to help them to maintain and be viable citizens in our community. We provide group and individual therapy. Again, we provide all of these services to adults as well as kids. We have several licensed clinicians here, either LCSWs, which is a licensed clinical social worker, or LPC, which is a licensed practical counselor. That individuals that are in need, they will come and they will be able to talk to. Most of the persons that receive that service come in once a month or twice a month. It really depends on the frequency of what their needs are. So those are just a couple of the services that we provide here for mental health and substance use. And on the other side of the house, we also, as I stated, provide services to persons that have a developmental disability. A couple of those services that we do there include supportive case management, wherein which we help those individuals and family members find services, i.e. housing, benefits, day programming in the community that can help them thrive within our community here in Portsmouth. We also have what's called the SHOP program, which is our day services program. Currently, we have currently we have approximately 25 individuals that have developmental disabilities or intellectual disabilities that come to our day program every day, and they just love it. We help them learn different activities. We do things with them like dancing. We take them out into the community so that they can see those things that they wouldn't normally see, to help them integrate into our community, because they are people just like us, and they want the same things as we do.
That's right. James?
I worked, not worked, but I was volunteer on a state committee, several state committees that they had that would sort of oversee some of the, well, one of them was the Pines that I was on, the one that was down closer to downtown. And we sort of they would report to us each month about the operations, mainly about incidents that would happen. And the committee had clinicians and regular season citizens and people who have used the services before. So I understand some of the things that go on there. I work with Mr. Day. I don't know if you know
Yeah, Reggie Day.
Day.
Mr.
Yeah,
Reginald
Yes,
Day.
Reginald
Reginald
Day.
Day. Worked with him years, and he would move me from committee to committee because we could serve 2 terms. But I really enjoyed that until they discontinued that. But I saw, probably some of the things that you all deal with from day to day. And what I wanted to say, a lot of people get the social services sometimes and, that department mixed up with what behavioral health care does. Um, and social services is a little different. A lot of things, a lot of services depend on income. Is it the same way with that? Because I wouldn't think that people that have a drug problem or something like that, that income would be an issue.
Well, that's a great question, Mr. Overton. Persons that are receiving services here with behavioral healthcare services, I would say probably about 60% of them do have Medicaid. But for those that don't have Medicaid, we do what's called, we serve them on a sliding fee scale. So it's all about their ability to pay. So when they first come in to our central intake, they will get an assessment through our central intake to determine exactly what services that they need. Coupled with that, they will get a fiscal assessment so that we can see what type of income that they have and what they can afford to pay us. We may have some individuals that may pay as little as $3 up to $100. So it really depends on that individual's income.
I would think whatever the price would be worth it
Well
to
worth it.
rid yourself of something like that.
So
What about, family intervention? Is that something that a family can do? They see a problem in one of their family members or individual. Could they come to you all and say, look, we need to, especially if that person is grown, you say you can't, they want help. But a family sees that this person is probably can't make decisions for himself and they're going down a road that might be detrimental to him, his family, and everybody else. Can a family come to you all and say, look, we need to get our family member or this person into some kind of program? Or do they have to come in, on their own voluntarily?
that's a great question. Absolutely. If you have a family member that is in need of services, I'll start if you have a family member that's in crisis, because that's how we oftentimes have individuals come into our services because they're having a mental health crisis. They may feel as though that they want to hurt themselves due to a traumatic event. They may have gotten to the point that they're so depressed and out of it, they don't get up to take care of their basic needs. They're not eating properly. They're not taking their medications, or they may have gotten to the point that they're so anxious that they want to harm someone, to do some harm to someone else. At that point, a family member can call our crisis line. We have someone that mans those phones 24/7, 365. With our crisis line, they will speak to a licensed clinician, which is in our emergency services department. At that time, our emergency services staff would do what's called a clinical assessment to determine if this family member would need to possibly go into a hospital, a psychiatric hospital, for a couple of days to get some treatment, to talk to someone else, to get some therapy, so forth and so on. Sometimes that's the route that it goes. Oftentimes it will go the other route, that the person may not meet criteria, and the person doesn't meet that criteria at that time, then what we would do is set them up for other outpatient services that we do here at Behavioral Healthcare Services. A couple of those services included, but not limited to, those that I mentioned earlier, whether it's case management services, group, individual, medication, and so forth.
Go
I'm
ahead.
sorry.
I'm sorry.
We also have persons that bring in their family members, whether it's adults or kids, to a program that's called Same Day Access. Our Same Day Access program is open Monday through Thursday from 8:30 to 2:30. You do not need an appointment. Walk-ups are welcome. Actually, walk-ups are encouraged.
Mhm.
Only thing you need to do is bring an ID so that we can see that you are a citizen of Portsmouth. And if you do have any financial means, like a paycheck or something like that, or your insurance card, at that time, you would have a licensed clinician to complete an assessment on you as well to determine which of our services within behavioral healthcare services that you can benefit from the most. They will then refer you to that service so that we can begin to help you in your recovery process. And again, there is no wait list.
Mhm.
It's just walk in.
And that's good because more and more insurances are covering those services, because they see that now as just as much as just as important as physical health, the
Yes,
mental
sir.
health and drug problems like that. And Leah, before you go on, I want to switch a little bit to the Women's Center, and because this probably will take you all into the Bloomberg study and what came out of that, because we talk a lot on this show about the root causes of some of the problems our youth are having. And the Women's Center, and as well as the group sessions you all have, involve lessons about parenting. And I think that's very important, because it has to start there. That's one of the places it has to start. People knowing how to parent, So if you all, the two of y'all, can include that sort of thing, of what went on with the Bloomberg study as far as the behavioral healthcare environment and the citizens environment, like you, Leah,
Mhm.
and what we're going to get out of that as far as going forward in sort of solution-based problems that you all had to deal with, not problems, but issues y'all had to deal with. And I say solutions-based because something has to come out of that study
Mhm.
that's going to
Definitely so.
help us going forward. So
Mhm. Great, Nathan. You were a lead on that project, and I'll
Okay.
chime in.
Okay, awesome. Well, our Bloomberg study, this was a dynamic program. This was a program that was spearheaded by our mayor, Mayor Glover.
Mhm.
Our mayor had the vision that there is something that we could do here in the city of Portsmouth to help to deal with our youth violence and our youth crime. So he tapped into the Bloomberg study initiative. So what we did with this was look at different ways that we could combat the crime issue here in Portsmouth as it involved our youth. The first thing that I really enjoyed about it is that we had persons on this group from different places, from behavioral health, from public works, to parks and rec, to police and fire. So you had people that was talking about this issue from different perspectives, which gave us the ability to really see things that we perhaps didn't see before.
Mhm.
As we began to move forward more and more in this group, we began to bring in citizens, other stakeholders, some that had been affected by crime, some that have nonprofits that they work in this field when dealing with youth, and then some that just had that heart to see how we can make a change. So we started this project over a year ago. We met on a monthly basis.
Not monthly basis. We met
Well,
every week.
you're exactly right, Ms. Leah. We met on a weekly basis every month. And we had lots of spirited conversations on how we can do something different to combat crime, because what we have done up until this point just seemed not to click in the way we would want it to do. So we learned how to think innovatively. And when I say think innovatively, is truly thinking outside of the box.
Exactly.
You hear that phrase a lot, but the Bloomberg team, along with our coaches, took us to a whole nother level. We were able to come up with some prototypes to test on the kids and to test in the community as well. I'm happy to say, as we have concluded this process, we will be moving forward as we gain funding to continue with these prototypes that we have to implement them here in the city of Portsmouth.
And Nathan, and I mean, it was such a challenging experience because not only did we meet weekly with our coaches, but we also had to meet with Harvard professors who lectured us, and we had to be prepared on those Fridays for those lectures from those Harvard professors. But the amazing thing about the whole experience was, I like the idea that many of us knew of each other, but we didn't know each other. And as a result of this experience, we got to know each other. We actually got to become friends. Then we sort of became family. And the thing that I like as well is that because you got people from different walks of life, different departments, seeing things as they saw it. And then they had to come to the realization, maybe the way I'm seeing this is not the right way. This is not the right way. And then for us to have engaged the youth, the kids, gave the children an avenue to tell us what they wanted. We took to them what we saw and what we thought the needs were. And the kids came back and said, well, no, I think I like this. I want this. I want this. And they let us know that these are the things that they want, you know? And with the app prototype, all of the services can be on that app so that there would not be like a duplication of services. And plus parents would be able to see what services are provided, where they're provided, the times that they're provided, what the cost is for those services. And this way, it just gives the citizen a better avenue in which to be participants and have their children participate in programs here in the city of Portsmouth. So James, it was an amazing experience. It really was, you know, and we made it through a year's time, but we made it through, and it was good.
And whatever happens, healthcare services will be a pivotal part of
Definitely.
whatever happens going forward. And I think people that watch it need to understand that, and I've said this before on our shows, that projects like this, you know, don't happen overnight.
They don't.
Even though they are immediate solutions, but they're also long-term solutions. And no program, in my opinion, can be successful if you don't have long-term plans or solutions.
Exactly.
So you can't just say 6 months, I want this to be proved, you know, want this to be solved. So, you know, people have to understand, you know, as long as it doesn't, politics doesn't come into it, it's put on the shelf somewhere. So that's why we have to do this show, and we want you to come back. You know, this is not the end, but I'm saying we want you to come back and keep this conversation in the forefront. So
and James,
for the citizens who are the people who, in my opinion, run the city.
and James, and what you said is very crucial, because the one thing we learned in the Bloomberg Harvard project is that you may have come up with something, but then you test, retest, retest, retest until you come up with the final project. So it's not just that we've done this thing. So now we got to take it back to the citizens, let the citizens see it, and we have to improve upon those things that we came up with. So it's constantly a work in motion and constant motion.
And one of the other things that I can add to this, especially when it comes to what we're looking at doing with the kids. Anytime when you're working with kids, one of the things that we all know is that you have to be committed. You have to be in it for the long haul. Trying to change the mindset of kids don't happen overnight. Trying to instill or reinstill hope into kids don't happen overnight. And I can certainly say that the group that we're working with in Bloomberg, the group that we have here in Portsmouth, we are all committed to seeing this thing through.
Mhm.
So that's one of the reasons why I am a firm believer it's going to be successful.
Mhm.
I believe in it, and switching a little bit, I saw on the website also that they had a section in there, why seek treatment? And, just reading that section, you always get these stats about, how many people are experiencing, health issues, mental health issues or drug problems. And it has to be some success stories in there. You don't always see that. Now, a lot of times you might see people that have gone through the program that come out and give speeches or talks about their experiences and how they came through. But in my opinion, we don't see enough of what
Success stories.
y'all are actually doing.
Mhm.
And I just read about all these 44% or 44 million people are experiencing problems. And sometimes I want to see those success stories because I know as long as you all been around, it's might be not as many, but it's just as many success stories coming out of the program that you all offer. And people have to know that in order to entrust themselves
Mhm.
to you,
Mhm.
I think.
You are exactly right, Mr. Overton. And one of the programs that we really push with that is our peer services.
Mm.
Currently, we have, I want to say approximately 7 peers that work with us. And when I say peers, these are folk that have walked the walk and talked the talk.
Mhm.
These are persons that have been addicted to opiates, that have been addicted to heroin, cocaine. These are persons that have had an exacerbation of their mental health symptoms, where in which they have had to be hospitalized for months at a time. But now they are stable.
Mhm.
And they're not only stable, they're working, they are employees
Mhm.
of behavioral health care services.
Mhm.
And these employees help us engage other persons that were doing the things that they were doing, that didn't have hope or didn't see a way out or didn't believe that their lives could get better. So our peer services is a very intricate piece of what we do here. We have peers located here at our main building and our same-day access services, at our in our case management services, as well as in a program that we have at Hampton Roads Regional Jail.
Mhm.
We have 2 peers that provide counseling and discharge planning services there too. So just for a lot of people that are coming into our services, to hear the stories of our peers, I think it really motivates them and help them to engage in what we have to offer. And they just get so excited. And when we get to the point to assist them in doing the small things, like get housing, like get benefits that they never had previously, or helping them to get their medications.
Mhm.
It's a wonderful thing.
I'm so
Nathan,
glad you mentioned the jail part because, and I'll make this point, Leah, I promise, and you can get in. I'm
Yes,
glad you
please.
mentioned the jail part. I don't want to forget this. You mentioned the jail part because a lot of people don't realize how involved it is in that because stats also show that a high percentage of people that are in jail, they're in there with mental illnesses,
That's right. That's right.
problems that they have that makes their case a little different, because they're in there, a lot of them are in there for some things that they couldn't
Mhm.
help mentally.
That's
They
true.
have to serve their time. They have
That's
to
true.
do what they have to do for their crime,
Mhm.
but
Mhm.
they should be addressed differently than the general population per se. And you all are still, you mentioned that you all are still, you all are involved with that part of the process of helping people. I just wanted to mention that. Yeah.
But good job, James. But Nathan, my question is this. I know back in the early 70s when I was in New York City, I used to
Mhm.
see all the guys leaning from heroin. Is heroin on a rise in Portsmouth now? Because I am seeing a lot of guys and women who appear to be on heroin. Is heroin on a rise now in this area?
Well, I would say heroin is not only on the rise here in Portsmouth, it's on a rise through our entire country. One of the things, I go back to our the pandemic that we are essentially still in when it comes to COVID. Prior to that, we were dealing with an opiate epidemic of increased heroin users. It doesn't discriminate, male, female, old, and young.
That's right.
Then we get hit with this pandemic. And of course, with the pandemic, people are isolated now. They can't go places. You can't get the resources that you could previously. So that just heightened a lot of other issues that folk had. So we had this pandemic, but the opiate epidemic never went away at all. And now one of the things that we're seeing that we're faced with when persons are using heroin and other illicit drugs is being laced with what's called fentanyl.
Yes. Yes.
And we're seeing fentanyl is deadly, very deadly. Individuals can take a very small amount of fentanyl and die. It happens every hour on the hour. Again, not just here in the city of Portsmouth, but throughout the Hampton Roads area. So that is something that we are trying to combat by way of our methadone programs. Again, those persons that are getting methadone with us, they are also required to get counseling. Because we look at it as a two-pronged approach. We don't want you just come in to get dosed with your methadone and leave. We want to equip you with the tools that once you start having those cravings and those thoughts, that through counseling and therapy, you have developed those defense mechanisms to deal with it instead of succumbing to it.
Nathan, if I can call you Nathan.
Yes, sir.
Mr. Wood. But I remember we talked a little briefly before we came on air about when you all were coming into the new building, and it was announced that, or it got out that the methadone clinic would be there, and a lot of people were up in arms, and mainly one of the reasons because they thought most of the people on methadone were the street people, that might break in their homes and things like that. But actually, the methadone program was going on long before the new building, in the old building, and people didn't even realize that program was in there because of the people that were coming in there, and it was affecting people of all walks of life, not just the people hanging out on the street. You might see some doctors seeking treatment and things like that. So how has that been mitigated as far as the way people felt in the beginning and the way it is now? You've been there quite a while now, and I'm sure that opposition has toned down. But what did you all have to do to make the people in the surrounding communities comfortable with that program coming there?
Well, I think one of the biggest things that we did was we went out into the community. We went to civic league meetings, we went to church meetings and provided education. I think once people become educated about different things, they see it from a different perspective. The unknown scare people. So as you said, Mr. Overton, oftentimes people had in their mind that someone that is getting Suboxone or methadone, this is someone that's homeless, someone that doesn't have a job, this is someone that's going to break in your house, this is someone that's going to do you some harm, so forth and so on, which is so far from the truth. Again, opiate addiction does not discriminate. Color, creed, religion, age, occupation, what have you. We've seen the gambit. We've seen construction workers.
Mhm.
We're seeing doctors, lawyers, teachers. We've seen some of your neighbors that you may not even think.
Exactly. Exactly.
But I think that the biggest thing, to get back to your question, is to provide education to the community. So I think that the more that we educated the community about methadone, about Suboxone, about the persons that are in recovery and how we can help them collectively, those fears have subsided. However, we still continue to educate the community because you still have those naysayers that may be like, well, I'm not sure yet. So it's a continuous cycle, but we're here to continue to push that fact so that we can assist the citizens of Portsmouth in any way that we possibly can.
And you also have community programs in which you have vendors to come out, you come onto the streets to share information about what's taking place at behavioral health care, as well as other service providers throughout the city of Portsmouth. I know that you had it right at a time when we were having the Norcom walk around, so we couldn't participate. You all were on one side of the street, we were on the other side of the street.
Yeah.
But I know that you all have those programs in which you invite the public in and engage them with the activities that are taking place at behavioral health care. And that's crucial. And that's crucial because, as we stated when we first started, a lot of people really didn't know what was taking place. They didn't know all the services that were being provided because they all thought that it was for methadone or
Right.
it was for crazy folks, you know? I mean, that's the field that it happened. Now they can see there's so many other services that you provide, you know, counseling, crucial, especially at this stage. We've coming out of COVID. Who knows where we're going after when, I mean, the numbers are rising again. So, you know, there's just so many great things that are taking place at behavioral health care. And that was one of the reasons why we felt it was very necessary for you to come on and to share what you're doing, what's taking place there, because the public needs to know.
Well, I am very excited about this opportunity, and I'm very excited about everything that we're doing here. There are additional services and programs that we're looking at implementing here, especially when it comes to the kids, because we understand the younger that we can start to provide services or assist kids, the better possibility that they have a better future.
Exactly.
We look at the incident that happened in Newport News recently. Again, we want to make sure that we can wrap around whatever services we can to our youth because they need it.
That's right.
They need it. I always use the old adage, if you take hope away, what do you have? And what you have is nothing.
Yes.
So with us providing all the services that we do provide, again, our main goal is to give hope that there are some possibilities and there are some things that you still can do and that you can do. Because we're not going to give up on you, and we don't want you to give up on yourself.
Exactly. And
Yes.
Nathan, I'm trying to find something you had on your page, and I found it. I really love. You said number one, when you are alone, mind your thoughts. 2, when you are with friends, mind your tongue. 3, when you are angry, mind your temper. 4, when you are with a group, mind your behavior. And number 5, when you are in trouble, mind your emotions. That's powerful. That's powerful. And that's just what you're trying to teach individuals as they come through behavioral health services.
100%, Miss Leah. 100%.
And
Mr. Woodard, as you mentioned, programs upcoming about dealing with youth, will that include developing or creating a relationship with the school system, or do you already have one?
Absolutely. Well, right now we do have a relationship with our school system, where in which our prevention unit goes in, I want to say every other month, and do presentations to the kids as well as the faculty there. These presentations may include reasons not to smoke.
Exactly.
It may include lock and talk,
Mhm,
which speaks of gun safety,
mhm,
making sure that medications are locked and
mhm,
they aren't accessible to kids, making sure that your guns are locked
mhm.
and secured and not accessible to kids. We also talk about mental health first aid. Oftentimes when we think about first aid, we think, I got a cut, I got to give first aid
Yeah.
to my finger. But
Mhm.
you also have to give first aid to your mental health.
Exactly.
So the
Exactly.
same way I got to take care of that cut on my finger, I have to take care of my mind,
Mhm.
make sure that it is getting what it needs at all times.
Yeah, it's so important. The collective effort is what it's going to take in order for
Exactly.
us to
Exactly.
get a handle on what's going on out here in society today.
Mhm.
Yes,
And it's
sir.
going to be an ongoing effort, and it's going to take a little bit from everybody.
Yes, sir.
One of the
It
reasons
certainly
we have
does.
this show, spread the information.
Mhm. And Nathan, and and we're just so appreciative. I know your schedule is tight, really tight. We are thankful that you changed your time so that you can be here, so you can share this information with the citizens of Portsmouth. We know that you're gonna have to get off shortly, so we don't want to keep you beyond your time. So if you have a few closing words, so that we make sure that we get you off in the time in which we told you. James, you have something you want to say first
Yeah,
before?
before he does that, I want to shout out to Ursula Murphy, who put a comment up here about a person will relate to someone who tells them their story,
Mm-hmm.
and it takes one to know one. And
Mm-hmm.
anybody that knows Ursula knows her story.
Mm-hmm.
And we appreciate her being involved like she is and being open
Mm-hmm.
and transparent about what she's been through, because it's always going to be something like that's going to help others, especially
Exactly.
someone like her that with her personality and outgoing, telling her just
Mm-hmm.
what she went through. And you
Yes,
can
she
see her
is.
now, how she came out on the other end. So
Exactly.
just wanted to shout out to you, Ursula. Thanks
And,
for
and James,
watching.
and while you're doing your shout outs, one of
Mhm.
your Divine Nine brothers, Mr. Junius Williams, Junie Williams, Arturo Junie Williams is on here as well.
Well,
So,
we got we
and
got
I
a few.
failed to mention that you were part of the Divine Nine, which is a faux pas on my part. Okay.
Yeah, we always mention the Divine Nine, so it must be a cue here. So where's my recording of Atomic
There's a
Dog?
cue. There's a cue here. There's a cue
I
in the
want to
house.
see him, see if he can make that spin.
How about that?
I think I could have did that about 20 years ago, Mr. Overton. Not today.
You serve your time as far as that's concerned. Anyway,
Yes, sir. Yes, sir.
but thanks, Leah, for mentioning that, because we appreciate the Divine
Yes, we
Nine and
do.
everything that
We do.
they do. That's why we always mention, anybody
Exactly.
that's a part of that, because they are community first, so
Exactly.
they're important to what we do here as well.
So, Nathan, your time is drawing nigh. Do you have any closing words that you'd like to leave with the public?
I think that first I would like to say thank you guys for having this type of platform to put out information to the citizens. I think is invaluable. Any way that you can put out information and it could be helpful to citizens, I think that that's awesome. So I want to thank you two for what you do. The one word that I would like to leave everybody with, and I've said it a couple of times, is hope.
Mhm.
Is hope. One of the things that get in the way of hope is stigma.
Mhm.
One of the
Mhm.
things that get in the way of hope is not being motivated.
Mhm.
One of the things that get in the way of hope is not thinking that you can. One of the things that get in the way of hope is not seeing a way for tomorrow. But what I would like to say is for anyone, whether you're recovering from a mental health issue or a substance use disorder, there's always hope.
Mhm.
There's always hope. Find someone to talk to. That person could be your parent, it can be a teacher, it can be your pastor, it could be your best friend. But anytime you feel as though that you're losing hope,
Mhm.
talk to someone. Talk to someone. Don't allow it to overcome you. And don't allow it to take you to a place that you know that is not where you want to be.
Exactly.
So again, just keep hope.
Mhm.
Thank you. That was a great ending to what we were trying to do here.
Exactly.
We thank you,
Exactly.
man. Let's get this in. Portsmouth Coffee Talk is here for our voice
Our community
and our
and our
future.
future. And
And
we
we salute
salute
you.
you, Nathan. We salute you. A job well done. And I'm
Thank
so
you.
thankful that you agreed to come on and, to share this time with us, and we appreciate you so much. And I really have grown to appreciate you through Bloomberg Harvard more than you can ever imagine. So,
Likewise, likewise.
so thank you. Thank you. And Pat Carroll says, we appreciate you. We do appreciate you so very much. And thank you for coming on Portsmouth Coffee Talk.
And like
And
we
Nate,
said, we hope to have you back. Hope to have you
we're
back.
going to have to, especially if you got some special project that you're putting on and it's going to take place at Behavioral Health. Come on and share it so we can let the public know that this is taking place. Okay.
Absolutely, absolutely. Will
And we
do.
got you off in time for your next meeting. How about that?
Yeah.
Thank you, guys.
You're
Yeah.
quite welcome. You're quite welcome.
And
Thank
I'll
you.
say, join us Monday, as our guest will be Michael Allen Chapman. Of course, he's the brother of the Colonel, Virginia Tech grad. He's a Alpha,
Mhm.
but Divine Nine. But anyway, he's coming on. He's he advocates. He's been on the show several times. He advocates our students, especially in the African Americans, going to school and training to be engineers.
Mhm.
And he has some information, and he works with his alma mater, Virginia Tech and Norfolk State. And Leah, you'll like this bit of information. North Carolina A&T puts out the most
Yes, they do.
engineers in the country, even past Harvard.
Oh, yes.
And
Oh, yeah.
so
I'm behold the green and gold, but my granddaughter's Aggie Pride, honey. Aggie Pride all the way. Aggie Pride. So
we need to encourage more students to go into that
exactly.
field or just go to college and
Mhm.
period.
Very good.
Okay, that's our show. And thanks for everybody for watching, and we'll see you next time.
Thank you so
And
very much.
thank you, Mr.
Thank you,
Wood.
Nathan.
Appreciate it.
Thank you, guys.